Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
From the St. Louis Public Radio Newsroom, this is The Gateway. It's Tuesday, June 23rd. I'm Wayne Pratt. Public health experts are worried coronavirus restrictions might have been lifted too soon. That comes as Missouri reported 413 new COVID-19 cases Sunday, the first time state health officials reported more than 400 cases in a day. Many are still concerned about the wide spread of the virus.
I mean, the virus is like merciless, right? It doesn't give us credit for the pain that has already been incurred.
St. Louis Public Radio's Sarah Fenton tells us public health experts are worried about people forgetting about the daily threat of coronavirus. More on that in a bit. The Ethical Society of Police is disappointed in St. Louis County's slow response to a request for a seat at the table. County Executive Sam Page has signed a Memorandum of Understanding with the African American Police Union, but as St. Louis Public Radio's Andrea Henderson reports, the society says it's 13 months too late.
The union members sent the Memorandum of Understanding to St. Louis County officials last year. In addition to having it signed by County Executive Sam Page, they are asking for St. Louis County Police Chief Mary Barton and the Board of Police Commissioners to sign it as well. Sergeant Heather Taylor is the union's president. She says she wants the union to be acknowledged as an official organization for African American police in the county, and she wants racial discrimination recognized. A spokesperson for Page says the county is pleased to have the MOU signed and is willing to work with the union moving forward. I'm Andrea Henderson, St. Louis Public Radio.
At least one official in St. Louis says the addition of body cameras for officers is a way to restore trust in police. Public Safety Director Jimmy Edwards says letting people view the footage could be key in the relationship between police and the public.
The efficacy of body-worn cameras increases trust, accountability, transparency, and provides the best physical evidence, I believe, of events.
Edwards made those comments yesterday on St. Louis on the Air. St. Louis police could have body cameras within a month after the Board of Aldermen approved a $5 million contract to outfit about 60% of the department's officers with the technology. A new hospital at Fort Leonard Wood is under construction. The military installation in the Ozarks has started work on a $400 million replacement for the current 55-year-old facility. Lieutenant General Scott Dingell is Surgeon General of the Army. He says the new hospital is part of the military's long-term commitment to health care.
Today, we affirm that enduring care for our soldiers, their families, and all the beneficiaries will always be provided in the best facility.
The project will provide jobs for more than 4,000 workers over 4 years. The new hospital will serve the soldiers and families who live on post and more than 30,000 veterans. The Contemporary Art Museum will reopen its doors July 9th, but will limit the number of visitors to protect people from coronavirus. St. Louis Public Radio's Chad Davis reports the museum's health safeguards are designed to lure patrons back to its exhibits.
Only about 50 people at a time will be allowed to enter CAM every 15 or 30 minutes. Museum workers will disinfect public spaces every 2 hours. The museum will require all adult visitors and employees to wear masks. Lisa Melandri is CAM's executive director. She says the museum will resume showing exhibits by painter Derek Forger and photographer Liz Johnson-Arter. Melandri says both artists deserve to have their work shown.
I'm really excited about the museum being able to open and thinking about how are you able to have some of the pleasures, the experiences that we had pre-COVID.
The museum is planning to show new exhibits in September. I'm Chad Davis, St. Louis Public Radio.
Have coronavirus restrictions been lifted too soon? That question is receiving more attention after the state of Missouri reported more than 400 new cases in one day for the first time. That increase is mostly in rural areas of the state. Health officials in the St. Louis region say there have been fewer new cases each day compared to just a few weeks ago, but as St. Louis Public Radio's Sarah Fenton reports, there are concerns that many do not realize coronavirus is still a deadly threat.
At Flannery's Pub in downtown St. Louis, Tawani Russell is enjoying her first outing after months of being stuck at home in Madison, Illinois.
Being locked up in the house, it kind of messed with you mentally, physically, emotionally, and I needed to get out before I lost it.
When her niece called her up and asked her to join her on a trip to Washington Avenue, she decided it was finally time.
You know what I'm saying? I'm trying to make it normal as possible.
People like Russell have been excited to emerge from months of quarantine and return to that sense of normalcy. But some public health experts are concerned local officials lifted restrictions too soon. They worry the region could see the same spike in cases seen in Arizona and other states that were eager to reopen. Doctors concede reopening is always going to carry a certain amount of risk. Dr. Alexander Garza is the head of the St. Louis Metropolitan Pandemic Task Force.
If you talk to people that are purely wanting transmission to be at zero, they would say, we can't reopen until vaccine is here, right? And so you have to be able to balance those two to what is safe.
Officials lifted stay-at-home orders after COVID hospitalizations at the region's largest hospital systems began to decline. In mid-June, hospitalizations ticked up by a couple more people each day, but they're mostly holding steady or going down. Still, doctors are diagnosing hundreds of people with COVID in Missouri and Illinois each day. Garza added health departments are now able to pinpoint where outbreaks are occurring and that they're often in packed settings such as jails and nursing homes.
And so instead of using very sort of blunt instruments on a community, like everybody has to shelter in place or we need to close all restaurants, it's where are these cases coming from and is there any commonality to them?
Garza says hospitals now know more about how to treat patients, even though there isn't a vaccine or treatment, and how the virus spreads. And local officials say the region could avoid a spike in cases because they put restrictions in place quickly and lifted them more slowly. But others don't think St. Louis is completely ready. Alderwoman Kara Spencer has been vocal about the city's limited number of contact tracers. That's workers who track down people who may have been in contact with someone who tested positive for the virus.
Frankly, it doesn't feel like reopening entirely is the right course of action right now. And frankly, I think we should all remain extremely cautious and very diligent about how we're interacting in the public.
She's worried the lifting of restrictions sends the message the pandemic has been solved. Already, people have been gathering in crowds and leaving masks at home.
My fear is that our community is becoming complacent. And we cannot forget that the virus is still out there, and it's just as deadly as it was several months ago.
St. Louis and St. Louis County have announced they're planning to hire dozens more contact tracers in the coming weeks. The region's also able to test more than 2,000 people a day for the virus. Dr. Alvin Gang is an infectious disease expert at Washington University Medical School. He says those measures are encouraging, but St. Louis had a slow start in rolling them out. He says the next few weeks will be a crucial test of whether the region's reopening plan is working.
I do think, though, that we are still on a precipice, and that is something that I'm not sure. I think a lot of infectious disease people or epidemiologists sort of recognize, but I'm not sure that the public does.
Gang says the increased cases in other states should set off a warning that the virus could start spreading widely again. Officials need to be prepared to pause reopening plans or put restrictions back in place.
I mean, the virus is merciless, right? It doesn't give us credit for the pain that has already been incurred. And so we may have to step on the gas a little bit at some point, maybe not even in this so far distant future.
Gang says the public and local leaders need to social distance, wear a mask, and prepare for what could come next. I'm Sarah Fenton, St. Louis Public Radio.
Our David Casares edited that report. Shula Newman is the executive editor of St. Louis Public Radio. Music by Ryan McNeely of Adult Fur. I'm Wayne Pratt. From the St. Louis Public Radio Newsroom, this has been The Gateway.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.